Good afternoon, everyone. Welcome, and thank you for joining us for this last session of 2022 Kids. The name of this session is Driving Policy Change on the Social Drivers of Health. I am Adam Sotok, and I'm the Community Engagement Director here at NC Child. I'll introduce our speaker, Sarah, in just a moment, but before I do, I have some quick housekeeping and instructions for everyone. This session is completely bilingual in English and Spanish. We have a live interpreter on the line. Everyone will need to choose either the Spanish or English channel to hear the audio. If you do not choose an audio channel, you will not be able to hear the presenters. To choose a channel, look for the little image of the globe and the word interpretation on the bottom right side of your Zoom screen. Click that globe icon and choose either Spanish or English. If you choose the Spanish channel, you will hear the interpreter speaking in Spanish. You will also be able to hear the English language presenters at a low volume in the background. This session was recorded ahead of time, but we're also very fortunate to have with us here live Sarah Jacobson, who is the Government Relations Director for the North Carolina American Heart Association. And I know you're going to get a lot out of Sarah's presentation. The presentation was recorded ahead of time, so we'll be watching that on video, but then Sarah will be able to take your questions in the Q&A box and in the chat as we, throughout the presentation. So feel free to put those questions in the Q&A box, and we will get to those. We should have time after the presentation as well to take quite a few questions. And during the presentation, again, if you want to put things in the chat, Sarah will do her best to answer those questions as well. This session is being recorded, and the video will be available over the next week or two in both English and Spanish. We will send you an email when all the recorded sessions are available. So let's get started. And next you'll be hearing this presentation from Sarah Jacobson. Thank you.
Hi, everybody. My name's Sarah Jacobson, and I'm the Government Relations Director with the American Heart Association here in North Carolina. So this workshop is going to cover some of the social drivers of health and how all of these issues are connected, and then talk through how you can choose the issues you care about and how to advocate. I'm also going to have some questions for you to join in the conversation. So please share any thoughts and questions in the chat as we're going through the presentation. Okay, there we go. All right, first I want to talk about advocacy broadly. So for those of us who work in public policy, we try to get very specific about what we're trying to do. But we're using skills that you and I use every day in our lives and that our children learn from a very young age. So advocacy can be speaking on behalf of people. Like when a toddler is making the case to watch another Daniel Tiger episode. Can also be a process that you go through to support a cause. But we like to think more specifically. So how to put pressure on the people who have the power to give us what we want. And that is usually elected officials or other government leaders. So if you're trying to change policies, you want to be really strategic about who you're trying to target. So we also know that meetings and stories from constituents are far more powerful than someone who is paid to do it. So I'm a lobbyist, and we also work with contract lobbyists to help us build support for issues at the North Carolina legislature. But it's your stories, your perspective, that can change the hearts of lawmakers and lead to policy change. So in the chat, I would love for you to all answer these questions. When have you advocated for yourself or for others? And what were the most important skills you used? And I'll give a moment for you to answer. Okay, great. So here's what our workshop is going to look like today. First, we're going to talk about the big social drivers of health. And then we're going to discuss with so many different things you can work on in your community or at the state level. How do you choose what to focus on? And then finally, we'll talk about what are the steps you can take with your friends and members of your community to take action as an advocate. So let's talk about the social drivers of health first. So I'm with the American Heart Association, and we work on a lot of different health issues. Historically, we have focused on very traditional public health issues: nutrition, tobacco, physical activity, and then healthcare issues, or access to care and improving systems related to heart attack and stroke. But the public health community has, in recent years, started to really acknowledge the fact that you can't solve health issues by just focusing on the health system alone. We know that there are many important factors that contribute to health outcomes that public health advocates or anyone who cares about the well-being of our communities should be thinking about and working on. So the CDC's Healthy People 2030 has a really nice graph to show the social determinants of health. So we see that education, healthcare, and poverty, they're all connected. And these are some of the conditions that create the factors that create the conditions where people live. So officially, social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. So it's the idea that our environments matter, how our neighborhood is designed matters, the economic status of our parents matter for the opportunities we have to live our healthiest life. So as an advocate, there are a lot of spaces where you can make policy change that positively impact health. You don't just need to focus on healthcare. You can work on multiple policy spaces in your community and even at the state and federal level. And we know that all of it can lead to better health outcomes. So let's dive a little bit deeper into the different elements. So first, education access and quality. This could include, but is not exclusively, graduation from high school, enrollment in higher education, language and literacy, and early childhood education and development. And then we have the neighborhood and built environment. So what does our neighborhood look like? What's the quality of housing, access to transportation, availability of healthy foods, air and water quality, and neighborhood crime and violence? And then there's the social and community context. So the cohesion within a community, what civic participation looks like, discrimination, conditions in the workplace, and incarceration rates. And then there's economic stability, so poverty, employment, food security, and housing stability. And then finally, healthcare access and quality. So access to healthcare, primary care, health insurance coverage, and health literacy. They all intersect with each other, as you can see, and there are more things within these buckets that we can work on. But there's someone or some group in North Carolina who's working on each of these issues, either in your community or trying to change statewide or federal policy. So for example, the American Heart Association still focuses mostly on parts of these issues that intersect with public health. So availability of healthy foods, food security, access to health care, and health insurance. So we're going to go back to the chat. So looking at that list, what social determinants of health are the biggest issues in your community? I want you to think about the things you see, the challenges for your neighbors and friends that you think could be really important to work on. And I'll give you a moment again. Okay, great. All right. So, as you're thinking about the issues you most want to focus on, when we look at the list of social determinants of health, it can be really overwhelming, which is why it's very helpful to initially decide on one or two things to really focus on. And this is what we do in public policy organizations. We go through a process to figure out what makes the most sense to work on. And we call this process agenda setting. So the first thing to think about is what feels most important in your community? What is the problem to solve? And how can public policy help solve it? And then you want to think about your role in this. What do you feel you could personally pursue and keep working on for possibly several months or even years? Public policy change can take a long time, and you want to work on things that you feel passionate about. And the way that staff and volunteers in public policy organizations choose our priorities can be a little different from individuals. So we think to ourselves, what issues are most important to our central mission? An example of this is many organizations' decision to work on Medicaid expansion in North Carolina over the past several years. So groups like NC Child, the Rural Center, the North Carolina Justice Center, and others decided now years ago that this issue was something incredibly important, both to residents of the state and to the core missions of those organizations. Because access to healthcare, ensuring that people are able to get the preventative care they need, to be covered if they have a heart attack or stroke without financial devastation for their families, was really important to all of those organizations in different ways. And then I want you to think about, do you have a story to share with this issue? Are you or your family or community members impacted by this issue? You really want to think about that as you're moving forward and thinking about how you're going to communicate about the issue you're working on. So then the next step with agenda setting is, what are other people working on? We know that we can be much stronger as advocates when we work together. And it's good to see what your friends or other parents are working on in your community. And you can also do some research or reach out to state and local organizations. For example, there are a lot of groups, just off the top of my head, working on food insecurity issues, healthcare access, and early education. And it's good to do some research to see what the priorities are for other folks, because then you don't have to reinvent the wheel. You can help build on progress that people are already making. And this can also help you get connected and learn more about the issue. So next, where is the media attention and public conversation on this issue? It can be helpful to see what conversations are going on about the issue. And maybe there's nothing, which means you might need to be the one to drive the public dialogue about this issue. Or maybe the conversation has been dominated in a way that doesn't get to the heart of the issue, or doesn't talk about how to solve the problem. So these are all things to look at as you're evaluating whether or not to work on a policy issue. And then finally, you really want to think about what you are specifically trying to change and who the decision makers are. So what law needs to be changed? If it's a local school system issue, it may be the school board who can change an ordinance. Or a lot of affordable housing work is local and may require a bond referendum if you're looking for more money for affordable housing, which would probably need to be approved by local elected officials. Or, continuing to think about affordable housing, you may need local officials to make changes on their policies related to affordable housing. So different levels of government have different levers available to them to make changes. And this is when it can be really helpful to have a conversation with a policy expert, because it can get really complicated depending on what level of government you're talking about. With Medicaid expansion, we can't expand Medicaid at the local level in North Carolina. It has to be at the state level. But there are things that we can do at the local level to expand access to healthcare. But you can just do different things depending on what level of government you're talking about. So you want to think about that. Who are the decision makers? Local, it could be county commissioners, Board of Education. For state level policy, it is usually the state lawmakers, but it can also be an agency in charge of a certain policy space, or sometimes the governor. So you want to know that before you move forward with anything. And most of our efforts thinking about Medicaid expansion at the state level are really targeted with the state legislature. We know those are the people who can give us what we want. So knowing your targets will shape the way that you advocate for your cause. And you always want to be asking yourself, how will public policy help solve the problem? And that can help carry you forward as you make decisions about your policies. So in the chat, let's get back into the chat. Now that we talked through some of the steps to take to set your agenda, do you have any questions? And I'll give you a moment to respond, and we can chat in the chat box, and we can also discuss more at the end of the presentation. Okay, great. So now let's talk about how to advocate. So you've chosen your issue or issues. Now it's the fun part. So now let's talk about how you advocate. So we all know how to advocate for ourselves and our children when there's something we need to accomplish for them. And now we're extending those skills into some clear goals, influencing the elected officials to make the policy changes so that we can build a community that meets our vision. So first, you've got to make a plan. And this plan will change, but it's good to start with one. And it's helpful to work backwards. What's our vision? What's our long-term goal? What's our short-term goal? Having milestones as you work toward the goal is really important. So I'll talk a little bit about Medicaid expansion again. So for the American Heart Association, one of our national goals is for all people who reside in the US to have access to affordable, quality, and accessible healthcare. So health insurance in our current system is essential to that goal. And the states that have not yet expanded Medicaid account for much of the remaining uninsured population. So one of the steps across the country for us is to expand Medicaid. We have other incremental things we're doing to expand access to healthcare. But Medicaid expansion is a really big one because it makes up so much of the uninsured population. So you really want, sorry about that. Okay. So you want to make a plan and you want to know why you're doing it. And so as you make your plan, you need to collect some data and information that you're going to need as you build your case. This does not need to be a research paper, but are there existing reports that you can use? Is there other local or state data? And this is when it can be really helpful to connect with others doing similar work who can share information with you. Then you can create some kind of fact sheet or just some shared talking points or facts that you can share with your team so that you can make the case for your policy. And then you'll want to prepare your story. And I'll talk more about this later. So you've made a plan. And now as you build your case for the policy change you want to start educating your community members about the issue. You want to see if you can share your perspective at community meetings, share the information through social media. And a lot of this depends on who you're trying to influence. Again, if it's a school-related issue, you want to engage other parents. If it's our local food systems, you may want to think about farmers or food distribution organizations. And then you're going to want to start meeting with elected officials and other government officials. So I work a lot on tobacco policy. And whenever we're trying to pass policy at the state level, we first talk with our partners at the State Department of Health and Human Services in their tobacco branch. So they are true experts on the issues. They don't lobby or advocate in their roles, but they do the work, they implement the programs, and they are true experts and can get us the data we need. And they would likely be responsible for any policy that we pass related to tobacco. So it's really important to talk to the people who would be in charge of the policy you're thinking about. And then we also talk with our colleagues at the Department of Health and Human Services who can tell us what the priorities are for that agency. How much can they help us talking to the lawmakers? And then we start talking to the members of health committees in the state legislature. So there's a lot of groundwork, a lot of conversations you have before you have conversations with the elected officials. And a similar situation would take place if you're working on local policy. So before you meet with city council or county commissioners, you probably want to talk to city or county staff who oversee your issue. For example, we work on a lot of local food policy. One of our priorities is SNAP incentive programs. So investing public money to fund programs that help SNAP recipients leverage their benefits and get more fresh fruits and vegetables from local farmers. So we need to be talking to the staff who oversee those programs and any of the nonprofits who are actually implementing the program to build support, get a sense of their buy-in. And locally, I see this a lot locally where it's just much more common for staff in the city or county to drive funding conversations and policy changes because council members, county commissioners, they recognize that those are the people who have to implement it. And they often have much smaller staff than at the state level. So you really want broad buy-in, or at least starting the conversations with anyone who could be involved with the issue. So you start talking to people, it's really important. And then you adjust your plan. So as you move forward, things are going to change. It's inevitable. Your approach and your tactics are going to have to change because no campaign is without surprises and roadblocks along the way. So I'm going to show you an example of a straightforward advocacy plan. It can honestly be even more simpler than this, but this is a kind of mainstream advocacy planning chart from Midwest Academy that helps train people on campaign planning. So you have goals, you have your long-term, intermediate, and short-term goals. You have your organizational considerations. So those of us who are working in public policy organizations, we're thinking, is there money to work on this? To do a poll? Is there someone who has dedicated staff time? If you're more in a volunteer capacity, you're thinking about who has time to give their time to attend meetings or can give in-kind help, like helping with social media, things like that. And then you have your constituents, your allies, and your opponents. So constituents are your friends who are working on it with you. Allies are people who support but may not be part of the core team. Opponents are whoever is going to give you a hard time as you move forward. And then targets, you have your primary targets. So these are the one or two people who can give you what you want. And, everything you do should be about how do you eventually influence them. Your secondary targets are who are the core people who can influence those primary targets, either people they're friendly with, someone who sits on a committee with them, could be a volunteer who just has a strong personal relationship with them. And then tactics is kind of your bread and butter of campaigning. This is where you think about, okay, we need to put together a talking points sheet or a fact sheet. And what's that going to look like? What's that process going to look like? Issue education, which is the way we talk about how do we go about educating stakeholders and members of the public about this issue. Lawmaker engagement is thinking about, okay, let's make a plan for meeting with our elected officials. And then media advocacy, how are we going to engage the media so that they are talking about this issue in a way that really helps us propel the public policy forward. And then coalition building. Who else should be part of this group that isn't? How do we make sure that we are talking regularly and everybody stays on the same page? So this can be as complicated or as simple as you want, but these are all of the main things you want to be thinking about as you're making a campaign plan. And here's an example from a few years ago of a campaign plan for healthy food financing, so getting funding for healthy food retail into communities across North Carolina. So you see we have the long-term plan, which is passing policy, the intermediate plan, which was probably to get policy passed through a chamber, get a bill, get some support for it. And then we have organizational considerations. So we had a campaign coordinator. There were contract lobbyists who worked for different organizations who could help. And then there's the constituents. So all the organizations that were working on it. Key targets were Senator Brent Jackson in the Senate, who's a farmer and still in the legislature, still makes a lot of decisions about policy and appropriations. Nelson Dollar, who's no longer an elected official, but helps do budget work in the House side in our state legislature. And then we have tactics, so talking points, starting to think about an issue campaign, issue education campaign. So this is just to show you, not that you ever have to make a plan this complicated or dense, but that there are a lot of strategic considerations when you're making a plan. And so here are some of the campaign tactics, on that rightmost column. So as you make your plan, here's some of the common tactics that you can use. You may want to use all of them, but each one accomplishes different goals. So you can use different things at different times. So media is first, and media, just going back to the Medicaid expansion example, that's been a very important element of Medicaid expansion campaign. There has been a lot of work done over the past few years to educate reporters and create media events so that our issue is covered in a way that really propels the conversation in the right direction. And I think as a result, a lot of the conversation about this issue has changed. So that would be writing and submitting letters to the editor, pitching an op-ed, an opinion piece, sharing stories with reporters, or hosting media events like a press conference or other fun things you can do to bring the media along. And then, and these are all pretty traditional campaign tactics. Call your lawmaker's office, hold a phone banking event with friends to get folks to call in. Social media is a really common way to educate the public now. And you can also engage with elected officials in social media posts. Ooh. And then emailing your lawmakers and their staff. There's a lot of debate about how effective form emails, so action alerts from big organizations, how effective they are. But sometimes getting the volume in, a lot of people showing they care about something can be really important. Personal emails from a constituent to a lawmaker is always, I think, the most impactful in terms of emails. And then, of course, meetings with lawmakers in person or virtually during COVID. We'll talk a little bit more about that soon. And then contacting partners, building your coalition, getting more people on board who are supportive of your issue. All right, so meeting with elected officials. I want to focus in on this campaign tactic because this is really, as you saw in the graph at the very beginning of the workshop, it's really impactful for constituents to meet with elected officials. And so as an advocate, it's really great to really develop your story and then be able to share it with lawmakers. So Jerome Bruner, a cognitive psychologist, has said that a fact wrapped up in a story is 22 times more memorable. We all know this because this is how humans are, but it's easy to forget when we do public policy work that we have to combine the stats and the story, because you want to make the case to lawmakers about why your issue makes sense from the research. I think that's important. And a lot of lawmakers really pride themselves on trying to do things, to pass policies that make sense, and given, trying to make things better in the world. But it's the story that makes people feel the passion and the drive for an issue. The stories put the heart in our facts and figures, and it helps you connect the lawmakers to your constituents. Stories can also help gain more media attention of an issue as well. And I think we also forget your stories can help inspire new advocates to join. I know many of us have been affected from when we hear a news clip about a really powerful story that we say, wow, that's something I really want to do something about that. So stories are very powerful. And so thinking about meeting with an elected official, this is a really good, simple structure for organizing your meeting or your pitch. And it's the fishing metaphor, hook, line, and sinker. And it's very good to practice these things before you go into the meeting. So first, the hook, who you are. Capture the attention of the elected official. The line, I guess that's when you throw it out, throw out the fishing line. You share your stories and your statistics, and that's the part you really want to practice, is that combination of your story and some facts of how this issue is affecting your community. And then the sinker, that's the ask. So that's when you want to ask the elected official their position on the issue. So you want to find a way in this conversation to connect with the lawmaker. So you want to do your pitch, but you also want to build the relationship and have a conversation. So conversations go all over the place, and that's okay. But you want to try to politely bring them back, keep them on topic, because they might try to distract you with a conversation about something in the community or a mutual friend. And so you bring it back and you don't leave without the sinker. You want to ask them their position on the policy. And this is really important because even if they don't support it, it's important info to bring back to your team to think about next steps about what role this person could play. Do they support it? Are they ambivalent? Do they need more education? Are they an adamant no and you should never go in their office again? Hopefully not. That happens every once in a while. Usually people, I think about most things, people are often ambivalent and need more education and more relationship building. But you want to get the data as you're building the relationship. So again, building relationships with elected officials, I've heard it likened to going on a date. You know, you're getting to know the person. When you're first meeting them, you're kind of getting a sense of who the other person is. You don't want to come on too strong, but you want to build interest. So you really want to think about how are you engaging this person in a way that's going to really foster a long-term relationship. And, you know, whether it's a local elected official or a state lawmaker or a congressperson, you're there to build the relationship and help them get to know your community and establish yourself as a credible source for information and connections in the community and share stories with them. And so, you know, it's really important to find a way to connect and be respectful, even if they don't agree. And I really do think the stories, developing your perspective, your authentic perspective on an issue is really, really important. All right, we can turn it over to questions and conversations, but before I do, I just want to emphasize that I'm here for you as you go through this process. The folks at NC Child, I know, are here for you as a resource. And as you are exploring the different social determinants of health, the things you want to work on in your community, you can always reach out to us. We may not work on that issue, but we might be able to connect you to someone who does. And I know that grassroots organizers, government relations staff, we want to be a resource to direct passionate advocates in the right direction so that you can do the work that's really important to you. All of us here are working to improve our communities and create better policies so that everyone has the chance to live a long and healthy life with ample opportunities to be healthy. And we want to work together. So I want this to be a first step. Maybe it's a second or third step for you, but at the very least, a first step to ensure you feel really empowered to start working on making these changes in your community. So thank you so much.
Thank you, Sarah. That was terrific. I learned a lot as part of that presentation. I know everyone else did as well. And we do have a couple questions that we'd like to get to. And first, if we're able to make this work and get her unmuted, Tina Pearson, who is the executive director with the New Hanover Resiliency Task Force down in Wilmington, I think had her hand raised. So Tina?
That was an accident. I am so sorry. Though I have enjoyed the presentation very much.
Wonderful, wonderful. Well, no worries, Tina. Thank you. And so another question that came up, and Sarah, I'm going to just share it if I can, because not everybody was able to view it, is someone asked Sarah a question in the Q&A related to the fiscal cliff and sort of the drop off of being able to get benefits. And this is an issue that, of course, I know many of us care about. And so, you know, the question was, what if your issue spans several entities? For example, I'd like to advocate for changing from a hard income cap for subsidies to a sliding scale of support. Currently, we penalize career advancement by denying any subsidy support, housing, SNAP, childcare, et cetera, if a person makes just $1 over the cap, is the way it's being described. But these programs are housed in different government silos. So Sarah, do you want to expound upon what you said?
Yeah, and I'm not an expert in knowing about the caps for subsidies. I know these are programs that are operated at both at the federal, state, and local level, right? So these, and SNAP, housing, childcare, are all operated in totally different agencies. A lot of the times, states have different control, different decisions may be made at the state level versus the federal level versus the local level. So my thought when you're working in this space, that's a really complex space. Like, you're talking about doing a lot of different things. And so I think that's where it's really important to break down the different spaces. Even though obviously they're all connected, right? In our minds as advocates, and how you see things, how they function in the real world, is that they're all completely interconnected. One family may be facing an issue with all these different types of benefits, right? But the reality is that the policy change for each of these spaces may look kind of different. They may have different things that need to be changed. They may have different political barriers, even though they're so intertwined. And so it's really important to kind of map out, okay, how are we doing this in terms of housing? How are we doing this in terms of SNAP? And others on on this may know more about, like, is this something you'd really have to address at the federal level? And then you have a completely different way that you do the work, because as a local advocate, you may really want to connect with a national group who's working on this and see how can you communicate with elected officials in North Carolina to be educated on this issue. So long story short, it's really important when there's like a lot of complicated things you're trying to work on, is dividing them up, figuring out, what may be the most attainable to make changes. But that you really want to understand the specific policy change you're trying to make in each space. And that will drive your strategy.
I think that's great point, Sarah, for sure. And sort of really honing in maybe within that complex arena on kind of like, okay, well, what's one specific we might be able to make some progress on and move forward within this larger problem, per se. Another question came in, and it's related to, in general, how do we keep our advocates, community members' spirits up around advocacy, when we're fighting uphill battles a lot of the time, and long-term kind of things. I know I don't have to tell that to those of you in the sort of a realm of tobacco cessation, et cetera. So, what are your thoughts on that, Sarah?
Yeah, that's a really good question. And I think I definitely learned about the importance of patience and doing this work for the long haul by, initially doing work in the tobacco space and learning from people who had worked on tobacco policy in North Carolina, in a place where the industry is so powerful and, historically was even more powerful, that you have to be in it for the long haul. That doesn't make it any less frustrating when things take a really long time. And I think those of us who have been working on Medicaid expansion for many, many years, some on this call longer than others, you really have to find ways to stay energized. I think sometimes that means you take a step back, you take a break. Sometimes it means you find the new interesting ways of creating urgency around an issue. And I think that that's come up with Medicaid expansion a lot, where, there's always a new story or angle about why this is so important, that brings new urgency. And I think someone really early on in the chat said, bringing the importance of, make sure the human behind the ask is seen and respected. I think when people are authentically telling stories, sharing their own stories about whatever issue we're working on, the authenticity creates the urgency. It creates it helps build the drive. And I think it helps keep the energy going. And so I think for us as advocates, the more we can do to reach into our communities, to find what is real about the space we're working in, I think that helps make it have relevance. But I think, practically speaking, you want, if you're trying to keep your grassroots folks, your volunteers who you're working with engaged, you have to stay in communication with people. You have to continue training, having events, making your issue relevant to them and their communities. You have to keep that drumbeat going. I think that's really, really important, practically speaking.
Yeah, well said, Sarah. Shifting gears here a little bit, there was another question too related to, a lot of advocates, I'll include myself in this batch before I came to NC Child. A lot of advocates haven't worked a whole lot with large national organizations like the American Heart Association. And so might be wondering, well, how does an organization like American Heart Association support advocates at the local level and things that are happening, here in North Carolina or even locally in some of those campaigns?
Yeah, that's a good question. I think different national organizations have different strategies and different ways of doing work. A lot are very focused on federal and state work. The American Heart Association has become more and more interested in local work because there's this understanding that there's so much that we can do at the local level when it comes to promoting health and well-being in our communities. But it's still a space where I know in North Carolina, we're still just starting to do that. It depends on where we have staff and volunteers. And so I think it really depends. I think as local advocates, it's just good to know if in whatever space you're working in, whether it's housing or food, there probably is a national organization that's interested in supporting the work you do, even if they don't have a staff member in your community working on it actively. So there may be different levels of work that someone from a national org can do, but I think it's worth reaching out because there may be a lot of resources. There may be they could connect you with someone in a different community doing similar kind of work. So I think there's a potential for kind of creating more connections with others if you connect with national organization, but every national organization is different.
Yeah, no, thanks for that, Sarah. Appreciate it. One other question that you talked, obviously you talked a lot about the social drivers of health, and again, over the last few years, I've always been struck by, when people talk about, hey, a huge amount of a person's health is not their genetics and, what's happening inside their body per se. It's all of the things that surround their life. Are they living in a safe community or a healthy home or those type things? So I guess my question is, do you think that's a door, this idea of social drivers, social determinants of health, is that something that advocates can really use, in talking about those social drivers as a way to connect with policymakers? Do you think that's something that's really being embraced by elected leaders when advocates talk about it?
That's a good question. I think it depends on the policymaker. I think about a lot of state lawmakers. I think if you can make, healthcare costs, a lot of state lawmakers are thinking a lot about the cost of healthcare in our state because they have to write the budget. They have to spend money on Medicaid, and they see how much money tobacco use costs us in our Medicaid program. It's billions of dollars. I think if you can frame things in terms of the financial implications, the economic implications for certain kinds of lawmakers who are really attuned to that, then I think social determinants of health can be a powerful argument. And I think there are other lawmakers who are just much more attuned to how all of these things are connected. I live in Durham. Adam lives in Durham. Lawmakers in Durham are very attuned to how these things are all connected. There was not health equity, but the racial equity task force. There's a lot of conversation about how health plays into that when looking at, economic and just overall outcomes in Durham. So I think it depends, but I think there is the beginning of lawmakers starting to understand that everything is connected, right? Which a lot of us have known for a long time and thinking about how communities work and how individuals work. But I do think it can be a really great way to contextualize something that you're working on too.
Thank you, Sarah, for sharing your thoughts on that. I'm not seeing any other questions at this time. So Sarah, I guess I'll just ask you, do you have any other parting thoughts before we end the session?
No, well, yes. My last thought is just that, I stayed very broad in thinking about agenda setting, and it's hard to go more specific until you have a specific thing you're trying to work on. So I really, for anyone who wants to continue the conversation, I'm going to put my email in the chat and would love to chat with anyone who wants more resources or wants to think about any of these things and talk through them. I really do want to be here as a resource for folks, regardless of what issue you're working on. So I'm putting my email in the chat. Yeah, if you want the Midwest Academy chart, that's a really helpful tool, and it doesn't have to be as dense as the example I gave, but it's very helpful for staying organized. And so I really just wish the best for everyone who's working on these issues in your community, and appreciate the opportunity to speak with you all.
Oh, thanks so much, Sarah. And everyone, you've got her email, so take advantage. Sarah is a wonderful advocate. She'll help you out for sure. So everyone, this is going to sound a little scripted, what I say here, because it is scripted, but this is our last session of 2022 Kids. So we, of course, want to leave you all with some potential actions to take. So I will just say thank you, everyone, for attending this session. It's the last session and will conclude 2022 Kids. Before you all sign off, I want to remind you of the 3 actions we have asked you to take to be a voice for kids today. You can find links to all 3 of these actions on our website, and we're putting the link in the chat box right now. First, NC Child is collecting the stories of those who know what it's like to live without health insurance to help inform our state legislature as they work on closing the coverage gap this year. We need to hear your story and the stories of others in the communities. We talked a lot about stories throughout 2022 Kids. They are powerful. Second, we have an opportunity for you to reach out to our representatives in Washington and speak up for early education and care. There has been a lot of discussion at the federal level about increasing funding for early education, maybe going to a system of universal pre-K, offering more money for child care subsidy, et cetera, but we're not quite there yet. So we need to let our lawmakers in Washington know that this needs to be a priority. Finally, we can't let you go without talking about the upcoming midterm elections. We have some great tools for you to make sure the community you serve is registered and planning to vote. Our follow-up email has nonpartisan resources you can use at your nonprofit agency and in your community to engage people in the upcoming elections. We have a primary coming up in May and then a general election this November. We are putting a link in the chat box right now for all of these actions as has been mentioned. You'll be receiving an email from Lamine Perkins in just a few minutes. That email will contain a link to all the actions I just described, as well as the closing remarks and a link to the conference evaluation. Please take a moment to fill out that evaluation if you can. We really do appreciate your comments, and we'll take those to heart. Every session at 2022 Kids was recorded. Everyone who registered for 2022 Kids will get a follow-up email from Lamine within the next 2 weeks with links to all the recorded sessions from the conference. Those recordings will be available in both English and Spanish. Thank you so much, everyone, and take good care, and we will see you soon. Goodbye.